today. I'm going to be your nurse.
Good, how are you?
I'm doing good. I'm going to perform hand hygiene, provide privacy, and clean my stethoscope before we use it for the exam. I'm going to do a head-to-toe assessment on you today. Is that okay?
Mm-hmm.
Okay. I'm going to verify your name and date of birth.
Okay, Smith, 8299.
Okay, perfect. My patient has an athletic build. His mood is relaxed. He's very well spoken. He's clean and he's groomed. Can you tell me your name one more time?
Okay, Smith,
Can you tell me what you're, where you are,
the hospital,
what you're doing here today,
the exam,
and today's date?
the 16th.
Okay, my patient is alert and oriented times 4. So now we're going to go ahead and start with the cardiac questions. Have you had any chest pain recently, shortness of breath?
No.
Do you have any history of heart disease?
No.
Do you have anybody in your family that's history of heart disease?
No.
Okay. I'm going to inspect the 5 cardiac areas. We have aortic, pulmonic, Erb's point, tricuspid, and mitral. There are no lifts or heaves at this moment. Next, I'm going to palpate the areas to check for thrills or pulsations. No thrills or pulsations, but apical pulse is palpable at the 5th intercostal space. And now what I'm going to do is I'm going to listen to these 5 areas. First with my diaphragm. Okay, S1 and S2 sounds are present in all 5 areas, and the heart rate is regular, heart rhythm is regular. And now I'm going to use my bell to listen for heart murmurs. No heart murmurs present. Okay, and your apical heart rate that I listened to for 60 seconds was 72 beats per minute. Okay, do you have any questions for me regarding cardiac?
No.
Okay, so now I'm going to move down to your peripheral vascular system, alright? Have you noticed any swelling in your arms or your legs?
No.
Any lesions or skin changes?
No.
Any cramping in your legs or arms?
No.
Okay, so first thing I'm going to do is I'm going to look at your skin here. Skin is warm bilaterally to the touch. His skin color is brown, which is consistent with the patient's genetic background. That he is smooth and moisturized. Skin turgor, I'm going to pull here, is present and good. Alright, and now you can put your arms down. What I'm going to have you do is, since you're at 30 degrees, I'm going to have you turn to the left, and then I'm going to have you sit right up on 3, 90 degrees, okay? Keep your head turned to the left. 1, 2, 3. Okay, you can sit back. No JVD present. And now I'm going to palpate your carotid arteries. I'm actually going to remove this pillow here. Okay. One at a time. Okay. Carotid arteries are moderate in strength, smooth and equal bilaterally. Going to use my bell to listen for bruise. Hold your breath for me. Okay, no bruise present at this time. Okay, now I'm going to feel your peripheral pulses, okay? And have you turn your arms. First, I'm going to do radial pulse, and I'm going to count for 60 seconds, 30 seconds. Your radial pulse is 68 beats per minute. Now I'm going to do ulnar, brachial, femoral near the inguinal nodes, popliteal, dorsal tibialis, posterior tibialis, and dorsalis pedis. Okay, so all pulses are present, 2 plus strength, and regular and equal bilaterally. Okay, wonderful. So now I'm going to check out your lower extremities, okay? Before I do that though, I'm going to check your capillary refill on your hands, so I'm just going to squeeze. Capillary refill is less than 3 seconds on all 10 fingers, which is good. Okay. And patient's lower extremities, his legs are brown, there's hair present. Skin temperature is warm to the touch bilaterally. I'm going to check for pitting edema in each of these areas. I'm going to push down for 5 seconds to make sure there's no pitting edema. So in the shins, in the ankles, and at the top of the feet, no pitting edema. And now I'm going to do capillary refill on all toes. Capillary refill is brisk, which is good, less than 3 seconds, performing hand hygiene. Okay. Do you have any questions regarding your lower extremities?
No.
Okay. So now what we're going to do is we're going to examine your abdomen, okay? So we're going to lay you flat. When was your last bowel movement?
Today?
Have you had any abdominal cramping?
No.
Have you had any abdominal surgeries?
No.
Okay, good. So the first thing I'm going to do is inspect my patient's abdomen. His contour is rounded, his umbilicus is midline, inverted, and there's no hernia. Patient's abdomen is symmetrical and round, consistent with the patient's genetic background. Now I'm going to listen. Okay, bowel sounds are present in all 4 quadrants. Listening for bruits now using my bell. No aortic bruit present. Now I'm going to percuss. Okay, tympani and donus present, equal and bilaterally. And now I'm going to palpate. And as I palpate, I'm watching for facial expressions, for pain and tenderness. I'm also checking to see if there are any enlarged organs. Okay. No tenderness, no masses, no enlarged organs. Okay. Do you have any questions for me regarding your abdomen?
No.
Okay. So now what we're going to do is we're going to sit you up 90 degrees to examine your lungs and your thorax. Okay. You can go up more. Have you experienced any shortness of breath recently?
No.
Do you smoke cigarettes, vape, or pipe?
No.
Or have you had any recent history of lung cancer or lung disease?
No.
Okay. So first I'm going to inspect the area and I'm going to check for bulging or retractions in the intercostal spaces. My patient's chest is, anterior chest is symmetrical and brown, consistent with the patient's genetic background. There are no bulging or retractions in any of the intercostal spaces. Now I'm going to palpate starting from this over here to my left. Checking for tenderness, crepitus, no tenderness, no crepitus. And now I'm gonna put my hands down, you're gonna say 99, okay?
99, 99, 99, 99, 99.
Okay, tactile for minus is present and vibration is equal bilaterally. Okay, so after I've done palpation, now I'm going to percuss. Okay, resonance is present and equal bilaterally. And I'm going to take a listen, and when I listen, I'm going to listen on 4 times on each side, and you need to breathe with your mouth open, okay? Okay, after listening to all your inhales and exhales completely, breath sounds are unlabored, clear, regular, and equal bilaterally and in all lobes. And now I'm going to have you sit up so I can examine your posterior. Okay, posterior chest, shoulders are symmetrical. There are no retractions or bulging in the intercostal spaces. Patient's skin color is brown. There are no lesions. I'm going to have you take a deep breath and exhale. 1 more. Chest expansion is equal and bilateral. Okay, and anterior posterior ratio is 2 to 1. And now I'm going to palpate the areas. Okay, no masses, no tenderness, no crepitus. And now I need you to say 99.
99, 99, 99, 99.
Okay, tactile for minus is present and equal bilaterally. After that, I'm going to percuss. Okay, resonance is present and equal bilaterally. And now I'm going to listen again, breathe with your mouth open. I'm going to listen 4 times on each side, okay? Go ahead. Breath sounds are regular, clear, unlabored, bilaterally and in all lobes, and your respiratory rate was 18 breaths per minute. Do you have any questions for me regarding your exam today?
No.
Okay, that would be all. Perform hand hygiene and leave the room.